Good evening, everyone. Good evening. Welcome, Curious Minds. I'm Kathy Swift, registered dietitian nutritionist, co-founder of the Integrative and Functional Nutrition Academy, and a nutrition consultant for various organizations, including the Center for Mind-Body Medicine and the Institute for Functional Medicine, where I've served on their nutrition advisory board. I'm really excited that you are all here with us this evening because learning and integrating functional nutrition into your practice can be life and career changing in many ways. I know it was for me and continues to be. I am very pleased to introduce Dr. Sheila Dean, a registered and licensed dietitian nutritionist, board-certified clinical nutritionist, certified diabetes educator. Sheila is the owner of Palm Harbor Center for Health and Healing, an integrative and functional medicine-based private practice and wellness center in Palm Harbor, Florida. A published author, national speaker, and media spokesperson, Dr. Dean has taught nutrition science for over 19 years as adjunct professor at the University of Tampa, University of South Florida Morsani School of Medicine, Maryland University of Integrative Health, Schiller International University, Saybrook University, and St. Petersburg College. Dr. Dean is also the co-founder of the Integrative and Functional Nutrition Academy, or IFNA, as we like to say, which is our comprehensive online training and mentoring program designed to transform the practice of nutrition by using the most effective integrative and functional nutrition clinical tools and treatment protocols. I just want to mention a few logistics as we get started. For the best audio quality, everyone in the audience, all our curious minds, are muted for right now. That said, we encourage and value your participation, so please post your questions or your comments as they come up by typing them in at any time during the presentation using your webinar panel. And we'll have time at the end of Dr. Dean's presentation for the brief question and answer period. We're going to try to get to as many questions as possible, but if your question does not get answered this evening, please go ahead and email us at info@ifnacademy.com, and we'll do our very best to respond to you in a timely fashion. I just want to mention, too, that anyone who is not able to attend this evening's webinar, because every seat is full tonight, so you may have some colleagues who are texting you or emailing you about this. They will be receiving a link with a recording of the webinar along with some of the details of the webinar specials that we have lined up for you. So let's go ahead and get started. Please welcome my colleague, Dr. Sheila Dean.
Thank you, Kathy, for that introduction. And I am really excited and honored to be with all of you here tonight. Kathy, can you see my screen?
Yes, I can.
Okay, wonderful. So, we've had an amazing response. And again, just a reminder, if anybody is that you know was not able to get on tonight's webinar, we are going to be recording it. So no worries, everybody will be receiving that link. Well, folks, my goal for this evening is to share with you in a simple but clear way what integrative and functional nutrition is essentially about, what makes it so unique, so important, and why I personally could never go back to any other approach. I'd like to start by sharing my story, my journey with you. Around the year 2000, it was about the year 2000, I was a conventionally trained dietitian and certified diabetes educator working at the Joslin Diabetes Center. And as an educator and nutrition counselor, I was working in conjunction with this endocrinologist to support our patients with type 1 and type 2 diabetes and managing their symptoms. And as you can imagine, it was pretty traditional work within the limits of the standard of care at the time. In addition, I did have a small private practice on the side. I was using common and conventional tools in my toolkit at the time, tools like carb counting and food exchanges, calorie counts and reduced fat diets and that sort of a thing. And one day I found myself just kind of lamenting at how frankly unfulfilled I was feeling and how unfulfilling my career was to me. And my lack of satisfaction with my career at the time was just palpable. I remember asking myself, is this really all there is? Did I go through all of this work, 4 years of undergrad, and actually it took me 5 years, my clinical internship, these national board exams, just to kind of come up with these fairly basic meal plans? Because if that was all there was to the field, I was actually thinking about moving on. I was seriously contemplating a career change. And fortunately, around the same time, I began to hear rumblings of a relatively new term called functional medicine when a fellow RD made me aware of the various functional medicine courses and conferences. And at that time, the cost was staggering for me, but I took this leap of faith, and in September of 2001, I began this whole new educational process. And for me, it truly transformed my entire practice and my career. Just felt like this whole new world opened up to me regarding these scientifically supported methods for really preventing and healing my patients with their chronic disease, as opposed to like just merely managing their symptoms. And all these cases that were just coming my way with these conditions that I probably wouldn't have known how to handle otherwise were just suddenly turning into these success stories. People with intestinal problems, brain fog, fibromyalgia, people with all kinds of autoimmune diseases, thyroid conditions, hormone imbalances. And the more I implemented the tools that I was learning as a functional medicine dietitian, the more I found myself actually healing my patients. And I think there was a time where I was afraid of using that term heal, or dare I even say cure. But once I saw the power of functional nutrition in action, for me, I just knew I needed to learn as much as I could. And now, of course, getting the word out to as many nutrition professionals is our goal. So, you can imagine my career was it was immediately reinvigorated with this amazing new information and these new realms of understanding, and most of all, just really helping my patients. And it just set me on this course of lifelong learning using evidence-based systems biology, which is a term we'll talk about tonight, the systems biology approach, with nutrition being at the central focus for treatment and cure. So ultimately, I could see my practice becoming completely transformed and just infused with this new sense of energy. So, if there's someone out there, anyone out there in the audience tonight that's feeling disillusioned like I was about being a dietitian, or, just simply wants to expand their horizons and just learn about how to approach your patient cases from a functional nutrition approach, I want to invite you to come along on this amazing and wonderful journey with us to transform your practice and really your career. So that said, these are some of our session objectives. So I want to describe what makes the integrative and functional nutrition approach unique. We're going to identify just a few assessment tools for the integrative and functional nutrition practitioner, and sometimes you'll hear me say IFN for integrative and functional nutrition. We're going to use the IFN approach for clinical decision making, and I'm going to talk a little bit about why you might want to choose IFNA, or the Integrative and Functional Nutrition Academy, for your learning journey, for this learning journey. I want to start by bringing to your attention a special report that was published, 10 years now in the New England Journal of Medicine on the decline in life expectancy in the United States in the 21st century. Basically, what the authors write is the trend in the life expectancy of humans during the past 1,000 years has been characterized as a slow, steady increase. But unless effective population interventions to reduce obesity and chronic disease associated with it are developed, the steady rise in life expectancy observed in the modern era may soon come to an end. And this is the part, of course, that's the shocker of all this. And the youth of today may, on average, live less healthy and possibly even shorter lives than their parents. So let me say that again. The youth of today are actually expected to live shorter lives than their parents. So we really have our work cut out for us, y'all, and we really need to get out there. We need to help people. We need to really understand how to get our patients truly healthy, not just controlling their disease, not just, managing their symptoms, because it's even also been reported that somewhere by I think it was 2020, worldwide deaths from chronic disease are actually projected to total more than twice the number of deaths from infectious disease. So something like 50 million versus 20 million. It's just this insane number. So I think we need to just tease out a few important concepts. First, I'd like to clarify the difference between the acute care model versus the chronic disease model. And some of you may be familiar with this, but in order, I think, to understand nutrition today, I think we have to understand the state of medicine today. But I do want to take a moment just to pay homage to the training that healthcare professionals receive in acute care medicine and urgent care medicine and in emergency medicine. I mean, one of the greatest accomplishments of mankind is acute medical care, right? You can take someone who's having a heart attack or having an acute asthma attack, and you can save their life because they are going to stabilize that patient. They're going to lock down their physiology to keep them alive, because acute medical care is about crisis management, right? It's got to be expeditious. That's acute care medicine. But what happens when you try to use the acute care model to problems that are chronic in nature, right? It's like that image on the screen. It's like trying to fit a square peg into a round hole. And what happens is we're going to try to rush to diagnosis to name that disease. And we are all familiar with our patients instantly being put on medication, and certainly multiple medications. We are very familiar with the fact that patients are rushed to surgery. I mean, thyroids being snipped out and intestines being snipped out and gallbladders being taken out. Patients having their numbers treated really rather than focusing on what's going on with the patient. So like treating their A1C rather than really trying to understand the root cause of their hyperinsulinemia, or patients where we're just focused on their cholesterol level rather than trying to understand the big picture. And as you can imagine, we're cutting the patient into segments, right? The patient is not seen in the wholeness of who they are. And the results? Well, we're really only going to get to this sort of surface cursory understanding of our patient's story, because little attention is going to be paid to the patient's story beyond their chief complaint or their history of their illness. The whole story is not quite understood because we're really looking at them as with their symptoms in these silos, right? Each complaint becomes this discrete issue that's dealt in isolation from the others. And in fact, I remember that was done on purpose. I mean, when I used to work in a primary care office where if the patient had more than one complaint, they weren't actually allowed to bring it up. They were told that they had to come back for a separate office visit to be billed a separate ICD-9 code. I mean, it was done on purpose that way. It's sort of just the way things were. And so what we see, though, is that chronic disease, is the majority of what is coming into that medical office. I mean, at least 80% of what comes into a medical office is chronic illness. And I can say in my practice, I mean, it's really 100% of that's coming into a nutrition practice is chronic illness, right? Because the very nature of chronic disease is multifactorial, so that intervention has to be multidimensional, so that this old approach, this one molecule, one function, one disease, that may work for acute care medicine, but not for chronic disease. For chronic disease, we need to think of a new approach: multiple molecules, multiple functions, an orchestra of health, a systems biology approach, right? And this is a term that if you were to PubMed, you would see hundreds of papers on the subject. So why a systems biology approach? Because, folks, we need a new operating system. We need a whole new operating system. And the reason we need a new operating system is because chronic disease, and I know you know this, it's a food and lifestyle driven phenomenon. It's also environmentally controlled. It's a genetics influence phenomenon. So let's face it, it's not going to be conquered with drugs and surgery alone, right? It can be conquered if we integrate what we know about how the human body works with individualized, patient-centered, science-based, of course, evidence-based care that addresses the causes, the root causes of these complex chronic diseases, which we know they are rooted in lifestyle choices, environmental exposures, and genetic influence. Okay, so do you see what I'm saying? The transformation of the 21st century medicine from this prevailing acute care model, which has its place, to a far more effective chronic disease model is only going to succeed if we attack the underlying drivers of the epidemic, right? The complex lifelong interactions among the lifestyle, environmental, and genetic factors. So I think in order for us to be successful, we're going to have to pay much closer attention to these root causes rather than just naming the disease and prescribing drugs and surgery. Of course, that dietitians are not necessarily doing, but that's certainly a part of our paradigm, because those kind of strategies are just not sufficient. They're part of the approach, but they're just not, by them in and of themselves, they're just not sufficient. So that being said, I want to introduce the term functional medicine, which I think many of you are now familiar with, but for those of you who are not, the term functional medicine was coined in 1993 by the Dr. Jeffrey Bland to describe the medicine of the future, and I would even say the medicine of today. It's an approach. It's an approach that embraces the following core principles. And I'm going to list these out. I know you can read them, but I think these are so important that I'm just going to list them out, because I think that you'll want to have this for your reference. So this knowledge base, or this footprint of functional medicine being shaped by these core principles, are A, acknowledging the biochemical individuality of each human being based on concepts of genetics, environmental uniquenesses, and those are things that we can learn about via labs that are done as well, which we will be talking quite a bit about in multiple modules at IFNA. Incorporating a patient-centered rather than a disease-centered approach to treatment. So, for example, really focusing on the patient rather than just treating their numbers necessarily. Seeking a dynamic balance among the internal and the external factors in that patient's mind, body, spirit. Addressing the web-like interconnections, all these different interconnections of internal physiologic factors and system imbalances that we will be talking about in more detail in just a little bit. Identifying health as a positive vitality, not just the absence of disease, and emphasizing those factors that encourage a vigorous physiology. Promoting organ reserves. So we're referring to the functional capacity of our organs to support life, right? So when we're young, our organs have many, many more times the capacity that it takes to just simply function. So promoting that organ reserve is a means of enhancing the health span, not just the lifespan of each patient. And then finally, understanding that functional medicine is absolutely an evidence-based, science-using profession. So, what exactly then do we mean by integrative? Okay, so integrative, right, defined as the integration of multiple modalities of healing and therapy. So diet, food, and nutrition being at the very top of the list, certainly the responsible use of supplements, exercise, gentle exercise and movement like yoga or qigong, meditation, traditional Chinese medicine and or acupuncture, massage, and as you see, medications, pharmaceuticals are a part of this list. It's not like we're talking about completely excluding that. And then functional nutrition focuses on how whole foods and key nutrients modulate health and the process of healing, because nutrition is the cornerstone of functional medicine. And that's why everybody wants to do nutrition, right? The chiropractor wants to do nutrition. The nurses want to do nutrition. The doctors want to do nutrition, right? Everybody wants to do nutrition because everybody is figuring out that nutrition is the absolute cornerstone. And we as dietitians need to take this back. This is our turf. And because nutrition is not just prevention oriented, nutrition is therapeutic. Nutrients and foods are powerful, multi-targeted biological response modifiers. So for example, take iodine and vitamin D, right? Iodine and vitamin D receptors exist in many of the trillions of cells in our body and regulate cellular function. Magnesium alone is involved in like 2/3 of the enzymes involved in detox. Folic acid, or folate, I should say, excuse me. Look at all the different diseases and conditions related to poor folate metabolism. I think we're quite familiar with things like spina bifida and other neural tube defects. And this is really not a comprehensive list, just a limited list, but depression, anxiety, OCD, there's plenty of papers that talk about that. And we're going to go through all of this in the Integrative and Functional Nutrition Academy training modules and so much more. Alzheimer's diseases, cognitive decline, heart disease and stroke, cancer, high blood pressure. There's a ton of information about folate metabolism and detoxification, and certainly methylation, transmethylation, poor energy, and of course we're familiar with its relationship to the anemias, macrocytic and megaloblastic anemia, etc. So what you see here is that when a patient is diagnosed with an illness, it's not really the starting point. So you see the disease is the process that may not even be discovered until decades after the initial biochemical alterations, right? The patient diagnoses that you see up there at the top, that's just the tip of the iceberg. So as functional nutrition practitioners, what we're trying to do is understand the underlying causes, the root causes. So that's kind of what that picture is all about. And we do this by taking a personalized approach, trying to get to the root cause of chronic disease, try to reestablish that organ reserve and vitality that we were just talking about, and really trying to balance essential core areas of health. So that then begs the question, what are these core areas? So here is an illustration of a functional medicine web that was published by the Institute for Functional Medicine quite a while ago. It's actually an older version. They have come out with some of their newer versions, but to me, it's really one of my favorite because I just feel like it's really clear. I look at how all these core areas are all interconnected with, you know, a person's genetics being in the backdrop. So it's also interconnected to me that sometimes these systems, they're practically one and the same, all these complex interactions and multiple access points and ultimately having diverse effects. And so you can really see that very clearly with this illustration. So understanding then these pathways generates an approach to treatment that's focused on the individual rather than the disease and on the restoration of health and function rather than just managing symptoms. And it's going to be important to know how to identify the various core system imbalances that could really be at the root of many different conditions and vice versa, right? How one condition can contribute to many different system imbalances. So let me show you an example of that. So look at this example. Using this particular construct, you can see that it's possible that one disease or one condition can have multiple causes, just as one fundamental imbalance could be at the root of all these seemingly disparate conditions. So I think the most important precept to remember about functional medicine is that it's about restoring balance, because restoring balance is the key to restoring health. So for example, take high blood pressure, right? Your patient can certainly take a medication that's going to morph his or her enzyme system so that, let's say, renin is affected and blood pressure goes down, and that's fine. And no, we're not necessarily saying that our patient shouldn't be on the medication, but as nutrition professionals, we can also improve the integrity of the patient's vascular health, right? Why not approach it from that perspective as well with this functional nutrition approach, right? Getting to the root of it so that vasodilation and vasoconstriction starts to renormalize and blood pressure autocorrects. So what you see here is this continuum of pathology then. You know, Dr. Jeff Bland once said that the loss of function precedes the onset of disease. Disease does not come as a bump in the night, right? It comes as a consequence of declining function over time. I think when he said that, it really, really resonated with me, because it just helped me to understand this concept of the continuum of pathology. So for example, it starts with small, biochemical alterations, no major overt symptoms. But then over time, if there's no intervention, now we start to see impaired cellular function. We start to have some subclinical manifestations, maybe TSH numbers, for example, that aren't necessarily out of range, but you could see them creeping up. And naturally, most of the time in the traditional medical community, nobody really does anything about it, or maybe their patient is told to just come back and we'll keep an eye on it, that sort of a thing. And then over time, with no intervention, we start to see morphological or functional changes. We start to see early stage disease, maybe pre-diabetes, for example. And then, of course, and as usual, with nothing being done about it, they're walking in the door now and they have full-blown diagnosed pathology, full-blown tissue damage, organ failure. And so what we're saying is that functional interpretation of lab data, if we're able to learn how to identify these biochemical alterations earlier in this continuum, that this is going to allow us to have a stronger impact in terms of nutrition intervention than if we were to just sort of let all of these things slip through the cracks and wait until there's diagnosed pathology and they're all the way on the other side of this continuum of pathology. So let me just show you now this another continuum, sort of illustrating something similar. So you start with health, and eventually we have insufficiencies, let's say vitamin insufficiencies, and then eventually deficiencies and disease. So as an example of that, you might start with a patient that complains of feeling a little fatigued, a little achy, and now there's really nothing being done about it. So eventually it progresses to not just fatigue, but now they have pain, or maybe they have migraines. Maybe they're feeling cold a lot. Maybe there's a little weight gain. Maybe they're having some IBS symptoms. Fasting blood sugars are not out of range, but they're awfully high. They're 97, 98, 99, something around that area. And, once again, they're just being told, well, maybe they're being told, come on back in 6 months, we'll keep an eye on it, that sort of a thing. But certainly there's no specialty labs being done or any kind of real intervention at this point. Nothing's really billable. They're just being told to come back. But then over time, they come back and now, boom, they've got elevated TSH as an example, or their homocysteine, if somebody even thinks to check of it, is starting to creep up, or maybe their 25-hydroxy vitamin D is just tanked. Maybe now we see their HDLs are just really low. And if you should be so lucky to have a functional medicine doc, they're going to be checking something called MMA, which stands for methylmalonic acid. That's a functional marker for vitamin B12, or they might be checking something called FIGLU, that stands for form-immunoglutamate. That's a functional biomarker for folic acid. Or these days, more and more patients are walking in with genetic data. Many patients are having something called MTHFR, or their methylene tetrahydrofolate reductase enzyme or gene being tested. And genetics is huge, and we as practitioners need to know how to interpret these kinds of labs, how to understand, how to at least begin to understand the basics of what it means to be normal or wild type, what it means to have a low penetrance gene, what it means to be heterozygous or homozygous for this variant or that variant, how to look for pattern analysis. And these are going to be really important concepts that we need to know, because more and more patients are having these types of tests done and are turning to us to assist them with this information. And we are going to have all kinds of modules from the experts talking about this. We're going to cover this in quite a bit of detail, both right at the get-go in track 1 and then again all throughout track 2, track 3. So we'll be talking about that over and over again. So back to our continuum. And eventually, again, we see that at the end of the continuum of pathology, we've got that diagnosed pathology, we've got tissue damage, we've got organ failure, we've got hypothyroid disease, we've got full-blown cardiovascular disease, and all sorts of things. And so wouldn't it have been a lot better if we could have intervened a lot earlier in this continuum. One more example, just to really drive home this point, let's look at insulin resistance, right? So insulin resistance may start with just high insulin and a totally normal blood glucose. And this is a patient that's walking in with, maybe their blood sugar is somewhere in the 90s, but they're saying, I'm hungry, I'm gaining weight. And this is going to be that time where functional nutrition approaches, this is just shines. This is the perfect time to be able to jump in and say, okay, well, let's check your fasting insulin levels, right? Because you just might find out that when you look at their insulin, I'm not talking about their glucose, but their insulin, blood insulin levels, just a basic lab, you might find that it's actually very elevated. And there you start to get some clues about what's going on and how they actually have what's referred to as compensated hyperinsulinemia, right? So over time, though, if things like this are not checked into, then certainly, eventually those blood sugars just won't stay normal. And then, yes, they go on to develop prediabetes, impaired glucose tolerance, and eventually type 2 diabetes. So what we see then is that this one-size-fits-all approach is really out, that this personalized lifestyle medicine approach is really where it's at. And we're going to show you how to assess your patients from a functional medicine perspective right from the get-go. So 2 key questions to ask yourself when assessing your patient cases, because to manage the complexity that's just natural, it's just inherent in this approach, just a simple approach to get the ball rolling. And of course, we'll be sharing more details with you all about how to start that. But a simple approach is just to ask these 2 key questions. And that would be, for example, what does this person require to improve function in order to support their health and healing? So is, their diet, do they need a prescriptive therapeutic diet? Do they need supplemental nutrients? Do we need to start looking at other areas such as stress management? Do we need restorative sleep, light, love, and all of those important areas? But also on the other side of the balance, what needs to come out? What does this person need to remove to improve function in order to support that health and healing process? So again, stress, but also toxins. And we're going to be talking about what toxins, because it's not just about overt toxins, obvious toxins like maybe cigarette smoke or, lead poisoning. There's all sorts of possibilities here. And we'll be talking a lot about detoxification, biotransformation, what that means, and how to incorporate those concepts into clinical practice in a really strategic way, but also allergens, food sensitivities, food allergies, food intolerances, and infection is huge, pathogens, all of these things leading to inflammation and, in some people, this abnormal immune response, and of course, we're talking about autoimmunity here, which is huge. So really, there's really no one diet that's right for every person. I mean, when you're taking a customized approach, when you're looking at each person individually, what you start to realize is that not everyone is on the same program. I know when people call my office and ask, well, can you tell me a little bit about the program? My assistant will go on to explain that, well, there really is no one program. Everyone comes in and gets their own customized program. All right, so here is one of my favorite illustrations that helps you to really understand, what this is, how this all kind of comes together. So, for example, take a patient who comes to you, let's say, with some IBS or thyroid issues and fatigue and that sort of thing. Okay, so what you're seeing here is this cartoon illustration of the gut epithelia. And you can see the little finger-like projections there. Those are the villi. And you see the gap junctions that we know are not supposed to be cemented together, but they should be snug and they should be tight. But triggers like stress, chemical injury, medications, toxins, and even endotoxins and their lipopolysaccharide fragments, pathogens, altered dietary proteins like gliadin, foreign proteins, don't forget about that, maybe from those GMOs, all of these things, they can start to wear away at the integrity of the gut epithelia. And then those gap junctions, they start to wiggle open. What are we talking about? We're talking about intestinal permeability, also known as leaky gut. And if you do a PubMed search, you'll see a lot of information on intestinal permeability. So this leaky gut starts to develop. And these types of substances that we just talked about, they start to provoke a very powerful immune reaction. So, for example, on the other side, we see the immune cells, like say those dendritic cells. So the dendritic cells are there to sort of sample what's out there, and they're alerted by all of these different antigenic substances, and then they turn around and present it over to the CD4 cells. Houston, we have a problem. Right, so the CD4 cells then in turn start making T cells that start producing hundreds of these pro-inflammatory cytokines and proteins, right? So you may have heard of terms like TNF-alpha, interleukins, interferons. This is what we're talking about. These are those pro-inflammatory cytokines that are being produced because the immune system basically just got perturbed, causing all of this inflammation, and then in turn causing even more tissue damage. That's your body's effort to try to protect you, but that's not it. The CD4 cells are also going to most of the time make B cells, especially if there's a genetic predisposition to autoimmunity. And those B cells, they start making antibodies, right? So now where you make antibodies, that's going to depend on your patient's unique genetics. So some people, you're going to have antibodies, their bodies are going to make antibodies against their thyroid, right? But in some people, they're going to start making antibodies to their joints. That's rheumatoid arthritis. And in some people, you can even make antibodies to the brain, against the brain. So one thing I want to make sure I mention, and that is that it gets really tricky because sometimes it can take up to a decade to develop these antibodies. But the process has begun on that continuum that we were talking about earlier. Really, really important concept. So what would you do with that IBS patient, for example, that we were just talking about? Well, whatever you do, you definitely need a coherent and organized approach, or you're going to be sitting in that room with them for like 3 hours. So that's one of the most important things that we're going to be discussing at IFNA training, how to get you organized, how to approach this in a methodical way. We're going to be giving you all kinds of amazing tools that we have developed for you. So if you just start with that hammer in your toolkit, those 2 basic questions, you can ask yourself, what are the things that need to come out and what are the things that need to go in? So for example, you might consider maybe you need to eliminate gluten, right, as an offending agent. Maybe we need to eliminate dairy or corn or soy or grains or animal protein. I mean, we have to figure those things out. Certainly refined sugar, and if there's an infection, we need to figure it out, or have our physician colleagues help us figure these things out. Toxins, whether that's alcohol or preservatives or smoking or medications or a number of things. Stress management. But then, of course, the other side of the equation that we talked about earlier, that balance. So what do you put in? Well, maybe that patient needs some betaine hydrochloric acid. Uh, yeah, and as opposed to all of those PPIs that they're on, they might actually need some stomach acid. And for a lot of you, this is a concept you're very familiar with. And for others of you, that might be something new. And so we're going to be talking about this in all kinds of detail, again, in the very beginning of the training modules. And every module in all of the tracks, to a certain extent, we'll be also discussing supplements as well. So dedicated modules to supplements, and then other modules where we'll incorporate a conversation about supplements as it relates to the condition. Also, digestive enzymes, you might want to consider enzymes to help with digestion. What about probiotics? What strain, what species do we need to use? We're going to be going over all of these. Do they need prebiotics? Is it appropriate to use prebiotics? Maybe they need to eat more fermented foods. Maybe we need to pull fermented foods out. Glutamine, should we use glutamine? Should we be talking about methylated nutrients, methylfolate, methyl B12, or the activated forms of vitamin B6? And again, we'll be talking about all of those in detail, because you need to know those important little details, and there's quite a bit to know about them. It's not just about throwing a probiotic at a patient or just throwing some B complex at your patient. There's a lot of details you need to know when to do this, when the time is right. Omega-3 fish oils, fiber-rich foods you might want to consider adding, but also antioxidant-rich foods, or your whole foods that are rich in antioxidants, and of course phytochemicals, and we'll be talking about all of this in a lot of detail. Fresh fruits or vegetables, seeds, nuts, legumes, etc. So again, just a simple way for you to kind of get started with how you might go about assessing your patient. And so what you see here is at the Integrative and Functional Nutrition Academy, what we have are a lot of information for you regarding all of those clinical protocols, and there are quite a few, but also a very thorough discussion about dietary supplements, getting into a lot of detail about therapeutic elimination diets. I mean, we have a whole track just dedicated to therapeutic elimination diets, and an entire set of modules dedicated to conventional and functional labs, how to interpret them, what to look for, and certainly mind-body practices is going to be a component of every module. So here is the IFNT radial that some of you may have seen or heard of. And by the way, I'm very proud to say that it was Kathy Swift that took the lead on developing that IFNT radial back in 2011. So what you see is in the very center of the radial, you see the personalized nutrition care. And for the dietitians in the audience, we're very familiar with that ADIME model, right? Assessment, diagnosis, intervention, monitoring, evaluation. So what you see is that the radial then depicts that personalized nutrition care, and the nutrition care process then is influenced by these 5 key areas. So lifestyle, which of course includes our food and nutrition, your systems, so your signs and symptoms, the core imbalances, metabolic pathways and networks, and of course biomarkers and labs and all of those things. Also, what you see then is that surrounding that radial, you see those precipitating factors, but also the patient's unique genetics. And that's a really important conversation, a really important part or piece to this entire story that can affect the individual. So we need to use these types of clinical tools, and we have several that we're going to be introducing to you, so you can kind of pick and choose what you feel is comfortable for you to assist you in that decision-making process, because you've got to be thorough, you've got to be organized, and you have to learn how to prioritize all of this information that's just coming at you, so that you can also figure out where you might need to investigate a little deeper. So for the RDNs in the audience who are wondering, what does the Academy of Nutrition and Dietetics think about all this? What's their position on integrative and functional nutrition? Well, I think it's very interesting that they actually list integrative and functional medical centers as an entry-level job setting for the RDN. So, clearly this information needs to get out there. They also list key entry-level skills for the RDN and being able to apply integrative nutrition principles to the nutrition care process, including the use of nutritional genomics, there it is again, dietary supplements, and even herbal remedies. Just want to put a shout out for the DIFM DPG, that's the Dietitians in Integrative and Functional Medicine Dietetic Practice Group. This is an organization within the Academy of Nutrition and Dietetics that does a fantastic job in teaching some of these principles. They have lots of great resources for you, including one of my favorite resources, which is the newsletter. Actually, non-dietitians can join the Academy and thus join a DPG if that's something they're interested in, but they don't have to. So the key points then is that the functional medicine nutritionist takes the time to listen to the patient's story, recognizes that health and disease exist on that continuum. We spent quite a bit of time talking about that. Draws connections between those core areas of imbalance and looks for root causes of disease. And of course, it is integrative, so we're collaborating with other integrative and functional medicine or functional nutrition healthcare providers. And we're always assessing our knowledge and seeking additional training as needed in a systematic manner. And of course, here at IFNA, we plan on making sure that we cover all of these key points and really so much more. So now I just want to take a little turn and talk a little bit about why you might want to choose the Integrative and Functional Nutrition Academy. So here you see the homepage of our website, and a lot of people have asked us about this IFNCP credential, the Integrative and Functional Nutrition Certified Practitioner. And so we are offering the credential along with a certificate, so you might want to check that out. And here is a little graphic that helps you to see how you can interact with IFNA. So some of you who are not interested in the credential, well, if that's the case, you can just matriculate through the tracks and the different modules, and you can earn, so far we've got up to 108.5 continuing education units already pre-approved. But if you do go through tracks 1, 2, and 3, you will earn a certificate of training. But if you go through those 3 tracks and the therapeutic diets track and take that board exam, you will be awarded that IFNCP credential. So there's multiple ways in which you can interact with this, this program, this training. We are an accredited provider by the Commission on Dietetic Registration, so all of those CEUs will automatically be approved, which is a great thing. And here is basically your online learning management system, or your LMS, that you'll matriculate through. It's been that I essentially built and customized for IFNA. So for example, you'll click on track 1 and it will then take you to this next page where you'll see a very organized course shell with your announcements and your frequently asked questions. Let me take just a moment to talk about that community cafe forum. So in the community cafe forum, which is really strictly for our participants, we've got 2 sub-forums. We've got the general forum, which is where you introduce yourself to your classmates and your colleagues, and you get to know each other. You can chat with each other, but also the Case Cafe. The Case Cafe forum is the second sub-forum where you can post questions about your difficult cases or any case, and everybody will go back and forth and talk about what they've learned and help each each other to solve those cases. Naturally, the syllabus will be listed, and then all of your modules, for example, in track 1 are right there. And so let's say you click on one of those modules, let's say module 5 as an example, then you'll be taken to your lessons, and we have here everything listed out with a progress bar that lights up and tells you exactly where you are or where you left off in case you didn't finish in one setting. So you'll go through the course description and your learning objectives, and then we'll be giving you these pre-webinar reading materials that we think are really important that you at least look over before you start the module. And then, of course, there's the webinar, and you can participate in it live, but if you miss it, no worries. Everything is being recorded, and we've been getting lots of questions asking about that. So rest assured, folks, everything is being recorded, uploaded into the LMS or the Learning Management System, and you can always go back to it and access it whenever it's convenient for you. Also, every single corresponding Thursday, we're going to have a discussion, a full 1-hour Q&A with the speaker to go over all of your important questions and anything that you want to talk about. And so you've got a full hour for that, and that's being recorded as well. So if you miss it, it's there. Your PowerPoint's going to be downloadable, and it's yours to keep pretty much forever. We've got this fantastic, robust clinical toolkit that you're going to go nuts over. We've got mind-body practices associated with every module, and then wait until you see our additional resources page. Everything is beautifully annotated, and we are providing you with all the papers so that you don't have to go hunting for them, that we think are seminal papers and extremely pertinent and germane to the subject or to that module. And then there's a little quiz at the bottom, a quiz where you, a 5-question quiz that you take to just really make sure that we're all on the same page. And then when you're done with that, you matriculate on right to the next module. So rather than having Kathy or me speak on every subject, we decided that we really wanted to have a diverse group of interdisciplinary experts leading the webinars, right? Our all-star cast offering you the most cutting-edge information so that you have the benefit of a variety of perspectives, but also a flowing and cohesive program rather than just kind of hearing it all from me over and over again or all from Kathy over and over again. So you're going to get to hear it from the best of the best. We're really excited about that. And when you go to the website, you'll see that it's all listed out so you can see exactly who is covering what module, what topic. And then once you actually register for the courses and go into your course shell, you'll see a much more comprehensive and detailed out syllabus with all the information there as well. This is the therapeutic diets track syllabus for now as well. You see that we've got some amazing experts, including our very own Kathy Swift covering the 3rd module on therapeutic diets so we're really excited about this. This is going to be, I think, really, this is my favorite part of the entire program. We have not only 1, but 4 amazing culinary experts that I'm calling our dream team to lead you through this amazing culinary immersion experience that's actually coming up in April of next year. Be sure to check our website for more details on that. We've already got our location secured. It's going to be in the beautiful Berkshires of Massachusetts. So if you want to know more about that, go onto the website. It's all listed out. We'll be giving you or sending you more information as we get closer to that event. And then we also have the schedule up. A lot of people have been asking about dates, and orientation webinar is up as well. So we'll have a 1-hour orientation webinar and make sure we're all sort of on the same page before we get started, and that's all happening in October. So mark your calendars. But remember, if you can't make it, it's okay. It's all going to be recorded. All right, and so really I'm coming to the conclusion of our talk here, and to thank you, I want to make sure that you all know about this free ebook that we have up on our website. A lot of you have already downloaded it, actually thousands, and that's not an exaggeration. We have a few thousand that have already downloaded this ebook, but be sure to take a look. It's Kathy Swift generously donated her third edition of My Foundation Diet, a whole foods, gluten, and dairy-free 2-week elimination diet plan. It's yours to keep. So take a look. Be sure to visit the website. Be sure to also, you see those green bars next to it, be sure to check that out. A lot of your questions are answered right there in the frequently asked questions section, so definitely be sure to check that out. Okay, so a couple of goodies for you all. I want to mention that we have decided, and some of you may have noticed this if you went to our website, we've decided to extend that deadline for track 1 to this Friday, August 14th. It was the 7th, but we've decided to extend it to Friday the 14th. And another little special for you, if you register for both track 1 and track 2 by Friday the 14th, you're going to receive an additional 10% off the early bird rate. So let me clarify. So if you are a member of IFNA and you haven't registered yet, you're going to receive 10% off for being a member. But what I'm saying is you're also going to get another 10% off for registering for tracks 1 and 2 by Friday. So regular registration for track 2 is $13.49. Early bird is $12.49. If you're a member, it'll drop down to $11.24. And if you take advantage of this special, the price is just a little over $1,000. You cannot beat this price anywhere. I welcome you to shop around. This is the absolute most competitively priced rate for track 2. It's a $338 savings. So I am really, thank you for your attention. I want to now hand it over to Kathy Swift to see if we have any questions in the audience, and she'll be posing the question for you. So thank you so much. It was a pleasure, and I hope you all enjoyed the webinar this evening.
Thank you, Sheila. Thank you. Can you hear me okay?
I can hear you. Yeah.
Beautiful. You know, I just want to say that one of the other tools that we'll be integrating into each module is a mind-body practice. And I thought with that in mind, it would be wonderful if all our curious minds, if we took a relaxing breath together. Beautiful, beautiful content. Let's just all breathe.
That's a great idea, Kathy.
Sheila, thank you. It was very, very inspiring for me as an educator and for someone who's, you know, just really passionate like you about, you know, bringing others into this community of integrative and functional nutrition learners. So much rich content and food for thought. It has generated some great questions from our Curious Mind webinar attendants. I'm just going to, and I want to be very respectful of the time.
Yes.
So we'll breeze through a few of these.
Okay, yeah.
And I'll just mention, if we don't get to the questions, again, we will make sure that we send us an email and we will respond to your question. But one of the ones that's come up, Sheila, is will you be including training on nutritional genomics and nutrigenetic testing and interpretation? Very, very important one. Can you comment on that?
Yes, yes. No, excellent question. That's a fair question, and the answer is absolutely yes. As a matter of fact, from the get-go, right there in track 1, one of our modules in particular will be covering some labs, especially functional labs, and that will definitely come up. But then also, as I did mention earlier, throughout, especially track 2, you know, every module is going to incorporate a conversation, obviously around whole foods, but then also a discussion about supplements and labs. So those things will come up to a certain extent in all the modules. But then again, in track 3, we have not 1, but 2 entire modules dedicated to the subject. So we are going to go over it over and over and over again, because It's not really something you can get in just one training session, so we're going to be discussing it in little bits throughout all the training, and then again, dedicated to just the subject in a few of the modules. So, oh yes, absolutely.
Beautiful. Here's another one. Is it a certificate of training or a credential that IFNA offers? And I know you covered that, but if you can maybe just comment on it again.
Yeah, absolutely. So what you'll see is that it's actually both. I'm going back there right now, and I'm going to pull this up. It's right here. Yeah, so it's both. That's actually a question. I'm glad you brought that up. That's actually a question that I've noticed has been coming through via email a lot. It can be either one. In fact, it doesn't even have to be either. You can just matriculate through the program and just get your CEUs and off you go, and that's fine. But yes, we are offering a certificate. But above and beyond that, if you go through the whole program, we are absolutely offering the credential as well. So great question.
Beautiful. And Sheila, along those lines too, another question came up. How long does it take to complete all 3 tracks?
Great question. When it's all said and done, it's going to take between just about 9 months. So it's a really comprehensive program. You know, this is not just a weekend certification, folks. This is a comprehensive training program. We are doing our due diligence. So, you know, it's about 9 months in total.
And here's another one. Will we have handouts to print off and keep as resources when taking the course?
You could say that again. Yeah.
Okay.
Oh yes. We will have a ton of handouts, all sorts of therapeutic diet handouts and handouts related to that you can give to your patient, handouts that you can use for your own, slap on your own information, your own business card, and use for your own practice. I mean, there is so much. It's in your clinical toolkit. You won't know what to do with it all. There's so much, and so there's something for everyone. And some of it you may not need to use, and some of it you'll love. Yes, there's a lot of handouts.
Excellent. And let's see, one other question. You mentioned an immersion with the 4 culinary experts.
I sure did.
Do you want to talk about that briefly again? I know we're at 8:31 and we're very time conscious, but
Sure. Kathy, I know that you have also been really taking the lead on that one. I'm actually trying to get to that slide. Would you like to comment a little bit also? Here, I'm going to get there in just a moment. Let's see, where did I have that here?
Okay.
Let's see. We have...
Well, Sheila, you mentioned the Dream Team chef, and I will say that I've worked with all these wonderful culinary nutrition experts, Denise Pickett-Bernard, a PhD RDN, Rebecca Katz, Marty Wolfson, and also Stephanie Sachs, all published authors and such, and just a fun, wonderful group of women that we will be gathering here in the Berkshires where I live. It's a beautiful, beautiful resort. Every day, it's a weekend. It's a Friday afternoon, Friday evening, really through Sunday. And we'll be cooking, and it really will be a hands-on nutrition and food is medicine, I would say, immersion that will increase our culinary nutrition skills and competencies and knowledge, especially in some of the therapeutic elimination diets that we as functional nutritionists use. So we'll really have an immersion experience with this, and we'll also have the opportunity, which I'm really excited about, to enjoy and experience mind-body modalities like yoga and qigong and maybe even some forest bathing in the woods of the Berkshires. So yeah, so it's going to be not just great fun, but really a wonderful educational experience. So
thank you.
I'm really excited
Oh
about
yeah,
it.
I can't wait. I can't wait. So, well, listen, thank you for those questions, everyone. Thank you for your attention. I'm so sorry to anyone who was unable to actually hop on. The webinar was full, but I want to remind everybody that it's been recorded. We're going to be sending out a link tonight. I am not going to go to sleep until I get this link out to everybody. So, rest assured, you're going to get that, and you're going to get all the information about those webinar specials. So we hope you've enjoyed it, and we hope you have a fantastic evening. Thank you.
Thank you so much, everyone. Thanks for being with us tonight. Take care and enjoy the best of the rest of summer.